Vaccine Alliance, Global Call to Action Against Poverty and Abibinsroma Foundation presents 3 years anniversary of COVID-19 and the way forward. COVID-19 hit the world surprisingly as a pandemic with devastating health and socioeconomic consequences and uncertainties. An illness caused by severe acute respiratory syndrome, SARS-CoV-2. It was first identified as an outbreak of respiratory illness cases in Wuhan, Hubei Province City, China. It was reported to the World Health Organization (WHO) on December 31, 2019. The World Health Organization declared COVID-19 outbreak as a global health emergency. COVID-19 was finally declared a global pandemic on 11th of March 2020. The impact of COVID-19 brought the world to a standstill. With lockdowns and movement restrictions across the world, it became a difficult moment for global economies to survive. The infections increased and more reported death cases frightened and threatened the world. Yes, at the time, the world had no immediate remedy. People in Africa were said to be the most vulnerable, and the streets of Africa would be miserable with dead bodies. On the vaccines, the world had no specific vaccines at the time to remedy this global bombshell. Poor countries suffered equally without availability, accessibility, and affordability for vaccines, test kits, and medications. Health facilities were overstretched. Doctors and nurses lost their lives. Personal protective equipment and sanitizers became very expensive globally. The rich and poor died. Statesmen and women, including children, were all affected. As millions kept dying, the vaccines came. It was for richer countries to benefit due to its scarcity and intellectual property rights. 3 years on, many remain unvaccinated. China is still dealing with its rebound effect. Big pharmaceutical companies are making billions as many poor people continue to suffer and die. People lost their livelihoods and some families were broken. Countries are experiencing serious economic crisis globally. The impact of COVID-19 has worsened the attainment of the Sustainable Development Goals Agenda 2030. People's Vaccine Alliance, Global Call to Action Against Poverty, and Abibinsroma Foundation are making a global appeal to strengthen their voices for 1. Waiver on intellectual property rights on COVID-19 vaccine production, medical technologies, and test kits. Think about the vulnerable poor in that village or town. What is the fate of children under 15 years without a vaccine or access to self-test kits? Global leaders must accept that no country or person lives in isolation to another in this global village. For this reason, we are calling on big pharmaceutical companies, world leaders, the WHO, to consider saving and protecting lives over making gross profits. 2. Make rapid test kits available and affordable. Leave no one behind. COVID is alive. Be protected. TRIPS waiver now.
My name is Drusilla Simmons. I'm 13 years old and I'm a learner of Conti 7 number 2 JHS school. During the COVID-19, a lot of things happened. During this period, we all lived in fear because news was going around that if anybody stepped out of his or her home, he or she will get COVID-19 because it was a contagious disease. If we see our relatives, our friends, we couldn't freely communicate with them because we had to maintain social distancing. And even after managing to shake their hands, we had to wash it or sanitize it, which was very, very, very sad. COVID-19 has really negatively affected the education of children like me, since we missed a whole school year. And since we didn't know when the pandemic would be over, a lot of students were laid back and some weren't interested in their books anymore. So when we reopened school, some didn't come back to school. And during this period, a lot The prices of products and materials in Ghana had increased rapidly, and coupled up with the fact that the government had announced a lockdown, so our parents couldn't go to work and receive their salaries, making children from less privileged homes become devastated. And this increased the crime rate. Girls started engaging themselves in social vices such as prostitution, and the unlucky ones became pregnant, which led to serious cases of teenage pregnancy. Boys started engaging in internet fraud and cybercrime. Companies which sold foreign goods, most of them collapsed because the borders, the airports, the harbors, everywhere was closed. Nobody could go out, nobody could come in, which made importation and exportation impossible. COVID-19 has killed a lot of people. COVID-19 is one of the most dangerous, infectious, contagious diseases ever recorded in the world. And there was a way to prevent it, which was by taking the vaccine. But the vaccine was also designed at that time for people in their 50s and above. And some of these people couldn't even have strength to walk. They couldn't have strength to walk to places where they give out the vaccines for free. And some of them had to just sit down and die with the COVID-19. The COVID-19, people who had COVID-19 were discriminated and stigmatized because nobody wanted to socialize themselves with people who had COVID-19 in fear that they will also get some. COVID-19 delayed and interrupted the education of children like me. That is to say, our academic calendar was interrupted due to COVID-19. And I ask, should there be a rebound of COVID-19? What would be the fate of school children like me without the vaccines? Thank you.
Yeah. I'm Nelly, my public health nurse at General Hospital, in charge of the vaccination that went on recently. About the COVID, the impact that had on us. We had a lot of people queuing because the drugs were few, and then we had the people also being infected, the workers being infected, and the public also being infected. So we have to make sure that there was enough vaccines to vaccinate. We did all that we could, and then we had a lot of people being infected, the nurses themselves as well as the public. As time went on, the vaccines came in, so we vaccinated a lot of people. So a lot of people have not taken the vaccine. We do National Immunization Day and we go from house to house, and still people refuse to take it. But I'm pleading with the public that they should take the vaccination, because other countries have had rebound and a lot of things are happening. Other people also working in because they've gotten job, and that's it. Since 3 years that we started the vaccination, this is their first time, and they'll tell you because they are traveling or they've gotten a work and their bosses are saying they should come with the vaccine card. Now we have vaccines for the school children, the school going age, from age 12 to the pregnant women. We have vaccines for everyone, so they should come and take it. You take the first dose, the second dose, and then you take a booster. Even if you have taken the one dose, you can even come for the booster. It's very good that you take it so that you live healthy and long. It wasn't easy getting all the vaccines at a go, so some, for instance, the pregnant women were not taking the vaccination, and the school children who were not having it. But currently, we have for all the school children from age 12 to the pregnant woman, we have it for everyone. So everybody should come and take it.
My name is Sedubia. I'm a teacher. I don't only teach, I'm also a musician. I'm a visually impaired too. Yes, a visually impaired. And how COVID affected me personally. Being a teacher, we were told to be in the house for some time. That is the lockdown. And it was very, very boring. Even so boring, talking of my disability, that is the visual impairment. Nobody was there to help me. Family members were not around. I have to be in the house. Getting someone to help you move out to buy something was a problem because no one is ready to hold your hands since we were restricted not to get into contact with people. So it was a big challenge to me, but God being so good, we were able to go through that. So, and then talking of the music aspect too, because we were restricted not to be in the gatherings of people, we were not able to go out to play programs, and that affected our livelihood. It's really affected us because those we lost contact. People who used to call us are no more calling us, but by God's grace we are coming up small. Myself, I'm vaccinated because I believe that will help. So I think that especially those in the villages who don't get access to hospitals and all that, if they get their personal test kits, that will help them test. And not getting it just like that, there should be education. They have to be taught how to use it to help them check their status. My colleagues, or how do I say it, with my friends with disability, they also had, we had a challenge because there were no provision made for us to be vaccinated. As I said earlier, someone to hold your hands, to take you there was a problem. And using the white cane, I'm talking about visual impairment. We also have those who use the wheelchair and others. But I'm talking about visual impairment. Getting someone to hold your hands, to go there to be vaccinated was a big problem. Nobody was ready to do that because of the restrictions. And then there was no special attention for us, because I think that they should have arranged, maybe since we have social welfare, they could have used that channel to get to us easily in order to be vaccinated, because they have our numbers called. Personally, I was not called that they will be coming to our homes. I think that, as I said earlier, I think that they can use the social welfare as a channel to get to the people with disability, because each district has a social welfare. So, and then they have their numbers too. So when they get there, it will be easier to get to the people so that they'll be vaccinated. And then I'm encouraging my friends too that there is no fear in being vaccinated. You will not get any effects as we are hearing from people. So I will also encourage my students to be vaccinated. If only there is vaccination for their age group, I will encourage them to be vaccinated. Encourage that, because it's a good thing. For that one, maybe somebody even feels shy to go to where people are gathered to receive the vaccination. So if the person has a test kit to do it by him or herself, I think that would be the best solution. So wherever you find yourself, you can check it and see if virus or not. Thank you so much.
My name is Anita, 32 years of age, and I live in the community. But COVID-19 has been a blessing or a curse to Ghana. Coronavirus is a virus caused by disease infection caused by disease called COVID-19. It has affected many countries. Well, during the COVID time, I was affected because I was working with a pension company, but due to the lockdown, I have to be at home and I lost my job. I'm one kind of person who likes socialization. So during the lockdown, it makes it difficult for me to meet new people and socialize with other people. Also, I feel uncomfortable of wearing the nose mask, but due to COVID, I have to wear it compulsory, whether I like it or not. And it was even difficult for me to shake hand in hand with a friend because of COVID-19. Well, many people have misbetted about the COVID, but and so when it came to them, people were finding it difficult to take the vaccine. For instance, for me, because I have a little weakness in the muscle, I was very nervous a little about the vaccine. I have to talk to my personal doctors and other medical personnel before taking the vaccine. And even that one, it was difficult to get the vaccine at the right time. Thank you very much.
My name is Honorable Fred Boko, and the proprietor of Wonders International School, located in Bankuma on the New Jerusalem Road. Yes, I can say on authority that COVID has affected most of our schools. That due to that, it has also affected our educational system, because barely for about a year we were asked to stay at home. In short, I say that if there should be a vaccine for students as we have resumed now, and the COVID is not wiped away completely, it will go a long way to help us. We also need some test kits. When the thing broke up, we were giving the thermoguns that we're using. Those things have all spoiled. So if there should be some test kits to be given to all schools, both public and private, so that in case there's any spark, it can be used to attend to the children. On that note, my humble appeal to the government is that it should come to our AC from the background. As a result of COVID, it has stopped all my projects and other things. And I'm now organizing myself to see how far the good Lord will help me to get some funds to complete.
Yes. COVID had a great impact on the Ghanaian economy, and my constituency, being the industrial hub of Ghana, felt the biggest brunt of the COVID-19 pandemic. And people lost their jobs, people had to go home, companies had to downsize. It's affected the economy globally, but in my constituency, Tema Central, the impact was really felt because we host the harbour, we host international institutions, we host big manufacturing facilities who had to also lay off their workers or push their workers home or let them sit or work from home. and lost revenue. Some lost close to 1 billion cedis, steel manufacturers and co, because in those environments people have bodily contacts and therefore they have to shut down and wait. And the global downturn also affected us because we are an integral part of the global economy, and Tema Central is at the heart of West Africa's trade and industrialization. So we have felt the brunt. Even bringing it to our market level, we had to relocate our marketing and send them out to different places. Some of their customers never came back because they were no longer at their old stores, and a lot of things have changed. So for me, it's had a great impact on my constituency, and that is why I always advocate people to take the necessary measures to make sure that it does not resurge again and spread. So you keep washing your hands, sanitize, wear your face mask if possible, and then also make sure that kids that are around you are also clean, you sanitize them, and we take the basic hygiene precautions that we need to. I mean, COVID has also helped us, in another way, helped us to reduce the prevalence of diseases like cholera and co, because people's attention to their hygiene has improved, and people actually now can connect the dots between cleanliness and health, and therefore I think even though it's a bad disease, there's also a good side to it that you can always talk about. I also want to use your medium to call on global leaders and also our local leaders to push for the cancellation of the IPs, intellectual property rights, that some companies have over these vaccines. And yes, of course, it's their hard work and intellectual rights. However, the world needs it. The world needs cheaper versions of the same drugs. And if we are, we cannot put profits over lives. And therefore, we need to push for these intellectual properties rights to be waived, at least for a period, so that in this heat of the problem where COVID has subsided but not died out, we can still be able to take care of our citizens cheaply by producing the drugs here ourselves, or riding on the back of their intellectual rights, their intellectual property patents, to develop the generic versions of the medications in our communities and in our society. So in this session of Parliament, we've approved the National Vaccines Bill, which gives Ghanaian companies the right to produce vaccines in Ghana. However, there's a need for us to also participate and push for the call for vaccines and the IPs of vaccines to be made available to third world countries, similar to how medications for high blood pressure and co were made available to third world countries in the TRIPS agreement, which allowed for generic versions of those products to be produced. So we are also using our medium to push other legislators to fight for freeing up of IPs, so that local manufacturers can produce these needed vaccines in Ghana. That notwithstanding, the government of Ghana has committed a lot of funding to the state to the fight against COVID. And there's also the need for us to continually educate our people about the prevalence of COVID, because COVID has not gone away. It has just subsided. When you go to countries like China, it is still on the rise. When you go to many other places, and even new variants are developing every day, you may not be feeling the symptoms the way we felt the first time in 2019, 2020. But it is still there. It is mutating and changing over time, and scientists are also learning more about it over the period. So we give our hearts to all the scientists that have worked hard to make COVID a back burner, but the issues have not died out, and that we need to continually educate our people and let them know that COVID is still around, and that COVID is harmful. It can damage your organs, it can damage vital organs in your body, and can even break down your immune system. On that note, I want to say a big thank you to all of you.